There actually is going to be a hospital setting right across the street at the World Equestrian Games, so we can triage patients as needed. They don't have to go off the campus to a hospital, because during these World Equestrian Games, it's FEI sanctioned and they can't leave the facility, they can't leave the grounds. So what ends up happening is that there's a variety of different treatment veterinarians from Root and Riddle Hospital as well as Haggard Equine Medical. There's going to be treating veterinarians that will be there for all the different events. If a horse gets injured during that event, be it whatever it may be, they're going to have a treating veterinarian on the scene there. They will assess the patient, usually along with the team veterinarian. The team veterinarian knows this horse inside and out, and our vets have all the medications here. So usually they together look at the animal, and if it's something severe enough that just going back to their stall and taking care of them by the stall, if it's something more severe than that, then they come to our hospital setting, and then we could triage them there, and they're going to have 3 to 4 orthopedic surgeons. We're going to have 2 internal medicine doctors there, so they're going to have world-class veterinary care for whatever ailment they have, and we'll have the diagnostic features there too that we can get it done. To assure the animals are fit, all the animals before competition have to go through some sort of veterinary exam. That could be just a lameness exam by usually an FEI veterinarian that'll be on hand. There's a team of them for each different event that'll be on hand to assure these animals are healthy and sound enough to compete. If they see a problem, then that's usually when myself get involved or one of the orthopedic surgeons to get involved. Dr. Ken Allen is the overall coordinator for the veterinary hospital, so he's coordinated the veterinary teams. And it's just a small community, we all know each other, so we know how each one, what we can and cannot do. The toughest thing is going to be interpretation, having translators, because some of these teams, they don't speak any sort of English. So what Dr. Ken Allen has done is made sure we have translators available to us 24/7. We have a veterinarian that can't speak much English. That could be devastating to that animal, because if what I think he's saying is wrong, and I think he put this animal on a certain medication, and I interpret it wrong, that could be devastating to the animal's health. The biggest thing is that there's no tolerance. The rule is no tolerance for medications. They cannot have really any medications on board. And so for us as treating veterinarians, when we have an animal that is colicking, that is in certain kinds of pains, we just take out the non-steroidals, as is butanamine, and don't think twice. But as a competition, so as the FEI, we would have to ask these people, when is your horse competing? And we got to know the idea for the withdrawal times, because a lot of these horses will be over there for the 2 weeks. They're not going to be competing every day for 2 weeks. They may be in the last 3 days. And if they colic in the first 2 days, I can give them certain medications because they'll be out of their body. So the main thing is to know the withdrawal times from the medications, and we need to really ask once, twice, 3 times, when is this animal competing? Because if we give the medications and they're competing the next day, then these people travel all over the world to come here, and we just messed up their event, their lifelong dream. And the greatest thing about the equine hospital is that we'll have the resources there, the delegates, that can tell us right away. If I have any question about a certain medication I'm not sure of, I'll just pick up a phone, contact them. They could say, yes, that's approved, you'll be fine, up to 72 hours out, et cetera, et cetera. We're going to have computerized records, because what's happening is each one of us take a shift. I'm on for a day, and then I switch off with my colleague for a day. And so we got to make sure we have the perfect records, because what I'm doing, I want to make sure my colleague knows he's going to take on over, is going to be able to take care of them.